welcome again to the Medical Terminology Podcast. This episode is Chapter 4, Part 5, More Pathologies and Procedures. In this episode, I'm going to go over the remaining pathologies that tend to be tricky or difficult, either because they don't follow the normal rules as far as their word parts, or they have kind of unusual spellings. So here we go, Part 1, we're going to do pathologies. The first one is fasciitis, Fasciitis. This is a combination of fascio and itis. And you'll notice that the spelling looks a little odd. There's that double I in there. Now, if you look at the parsing with the word parts, we have fascio, which ends with an I and an O, and we're adding the suffix itis. And our combining vowel rule says that we need to drop the O because we're adding a suffix that begins with I. Well, when we do that, we get that double I, which looks kind of odd, but that is the correct spelling. Now, from the word parts, can you tell what the meaning of fasciitis is? Well, that would be the inflammation of the fascia. The next term is myalgia, myalgia. Myalgia means what? Well, from the word parts, you can tell it means pain in a muscle. And the reason I bring this word up is sometimes people tend to forget to drop that combining vowel O. Again, we're adding a suffix that begins in A, so we need to drop the combining vowel O so that the spelling is myalgia, myalgia. Sometimes people tend to spell that myalgia. I'm not really sure why that is, other than maybe just the term looks a little too short without the O in there, but it is myalgia. The next term is myocele, myocele. This term does not have unusual spelling. Sometimes people do tend to forget what its meaning is. If you remember from our discussion of word parts way back in episode 1 of this chapter, a cell is a term for a hernia. And the general term for a hernia simply means it's some type of tissue that has broken through the tissue that contains it. In this case, a myocele is a muscle that has ruptured through its sheath or its fascia. Now our next term is a little trickier because of the word parts. The next term is myolysis, myolys. That's a combination of myo, myo, and elysis or lysis, -lysis. This one's a little tricky because if you remember back in chapter 3 when we learned about lysis, we used that as part of a procedure, which meant the loosening of something. Specifically, we used it in the term arthrolysis, which was the loosening of a fused joint. Well, it has a different meaning here. Lysis can also mean degeneration or breakdown. So myolysis means a degeneration of muscle tissue. Not a loosening of muscle tissue, but a degeneration of muscle tissue. This is a pathology, not a procedure. The next term is polymyositis, polymyositis. Polymyositis breaks down as poly, P-O-L-Y, which means more than one, myoso, MYOS/O, which is an alternate word part for muscle. Notice that it's got the S in it. This is an unusual spelling. Myoso, not myo, myoso. And then we have the suffix itis. When we put it all together, we get polymyositis, which would mean the inflammation of more than one, that is to say multiple, voluntary muscles. So again, remember what poly means. Sometimes people forget that. And remember that this term for the inflammation of multiple voluntary muscles uses the unusual combining form for muscle. It's myoso. It's got that S in there. Okay, and the next one is myasthenia. Myasthenia. And that is a combination of myo and the suffix asthenia. And we did talk about that suffix back in the first episode, and we haven't really seen it since. Do you remember what asthenia means? Well, asthenia means weakness in a muscle. We kind of need to separate that from the suffix paresis, Paresis. Paresis means weakness and slight paralysis. Asthenia just means weakness. There's no paralysis going on. It's just a form of weakness. So myasthenia would mean weakness in a muscle. Well, that leads us to a specific type of disorder that is presented in the textbook, and you may have heard of it. It gets mentioned in the common vernacular, and that's myasthenia gravis. Myasthenia, there's myasthenia, and gravis, gravis. Now, literally, that would translate as a serious weakness in a muscle. Gravis is a form meaning grave, basically. It's kind of where our word grave comes from. So myasthenia gravis is a chronic autoimmune disorder that affects the neuromuscular trunk, resulting in serious muscular weakness. So it's an autoimmune disorder, meaning it's a product of inflammation. It affects the neuromuscular trunk, resulting in serious muscular weakness. And then another somewhat famous disorder, let's say, is muscular dystrophy. Muscular, meaning pertaining to muscles, right? Dystrophy, dystrophy, which would mean literally difficult growth or development. Now, unlike myasthenia gravis, muscular dystrophy is a genetic disorder. It's a genetic disorder that causes progressive muscular weakness without affecting the nervous system. That's a little different than myasthenia gravis because affecting the neuromuscular trunk, it's affecting the nerves, which then results in the weakness. Muscular dystrophy is directly affecting the muscles. It doesn't affect the nervous system. And then the next word is one that really comes out of left field. It's got word parts that you would think, where's this coming from? Because we haven't seen anything like this before. The term is sarcopenia, Sarcopenia. It's composed of sarco, Sarc/O, and penia, Penia. Now, sarco literally refers to tissue. And we have seen penia before, like in the term osteopenia, meaning less than expected or less than normal. So this would be less than normal tissue. Well, that doesn't exactly mean much. This term actually means a loss of muscle mass and strength that is associated with aging. Over time, people just tend to lose muscle mass and strength unless they do a lot of weightlifting and exercise to help keep themselves together to counteract that loss. So sarcopenia means loss of muscle mass and strength associated with aging, and there's no way to get that one from the word parts. You're just going to have to memorize it. It's just an oddball term. Okay, the next one is tendinitis. Tendinitis. And I bring this one up because it has an unusual spelling because it's based on a combining form that's one of the alternate ones for tendon. This word is composed of tendino, Tendin/O, plus itis. And of course, tendinitis means inflammation of a tendon. The next term is another one that comes a little bit out of left field. It's got word parts we just have not seen before. That's epicondylitis. Epicondylitis. And this term means inflammation of an elbow. And it helps to spell it if you look at the word parts, parse it down. It's got epi in it, EPI, condylo, CONDYL/O, and then finally itis, epicondylitis, inflammation of an elbow. Now the next two are really commonly confused terms. They're very hard to keep straight, and I'll see if I can try to help you with that. We have sprain, SPRAIN, and strain, STRAIN. And part of the problem, of course, is we use these in the common vernacular, but perhaps not accurately. So, we may be really fuzzy on what they mean, even though we use the terms. But in the medical sense, here's what they mean. A sprain, SPRAIN, is an injury to a joint, and it's associated with a stretched or torn ligament. We can think of a sprained ankle. What happens with a sprained ankle is in that ankle joint there, the ligaments will stretch or possibly tear, and that will result in the spraining of the ankle. So spraining happens to a joint and involves ligaments. Now a strain, STRAIN, is an injury to a muscle or a tendon that's associated with overuse or again stretching or tearing. So a strain happens to a muscle. We strain a muscle, we strain a tendon. On the other hand, we sprain a joint. Think of ankle joint. So try to use that as a mnemonic. We sprain an ankle joint, we strain a muscle. And that will help you keep those straight. You'll just need to say them to yourself over and over until you've got it. Okay, that covers the pathologies. Now we're going to go back and do some practice. I'm going to throw out a definition to you, and I want you to come up with the term spelled correctly. Okay, number 1. What is the term for the degeneration of muscle tissue? That's myolysis, MYOLYSIS. What is the term for weakness in a muscle? That's myasthenia, MYASTHENIA, myasthenia. What is the term for an injury to a muscle or tendon associated with overuse or a stretched or torn muscle or tendon? Well, that's the strain, STRAIN. What is the term for the loss of muscle mass and strength that's normally associated with aging? That's sarcopenia. 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 What is the term for the inflammation of multiple voluntary muscles? That's polymyositis. 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 What is the term for the inflammation of a tendon? This has a tricky spelling. It's tendinitis. 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 What is the term for the inflammation of a fascia? That's fasciitis. 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 And what is the term for pain in a muscle? That's myalgia. Myalgia. What is the term for a group of genetic disorders that cause progressive muscular weakness without affecting the nervous system? That's muscular dystrophy. Muscular dystrophy. Dystrophy. And what is the term for an injury to a joint that's associated with a stretched or torn ligament? That's a sprain. 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 And what is the term for a muscle that has ruptured through its sheath? That's a myocele. Myocele. And what is the term for the inflammation of an elbow? That's epicondylitis. 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 And what is the term for a chronic autoimmune disorder that affects the neuromuscular trunk, resulting in serious muscular weakness? Well, that's myasthenia gravis. Myasthenia gravis. Gravis. Okay, that covers the tricky pathologies in this chapter. Now I'd like to go on in the second part and talk about some procedures that again tend to be a little confusing or difficult. First of all, I'm going to point out something that is actually an error in the textbook. We have a term for a medication that relaxes smooth muscles in the stomach or intestines. And the term they give us is antispasmodic. Antispasmodic. They give antispasmodic as a primary term, and that's an acceptable term. We use it in the common vernacular, and it's used medically. But then in the orangish type, they give us an alternate term, which is anticholinergic, and they misspell that term. They misspell it ANTICHOLINGER. That's the misspelling, that GER. They've spelled it anticholinergic, and that's not the correct term. The correct term is anticholinergic, and that would be spelled ANTICHOLINERGIC. So they flipped those letters around. It should be ERG, and they have it GER. And actually, anticholinergic is really the more technical term. Antispasmodic is a little more colloquial or common, but the textbook does give us antispasmodic as the primary term. But I wanted you to be careful of that misspelling should you try to use that word for anticholinergic. Okay, the next term we have to talk about is confusing again because of the double meaning of the suffix elysis or lysis. They give us the word tenolysis, TENOLYSIS, and this is a procedure, not a condition, and this is the release or loosening of a tendon from adhesions. An adhesion is fibrous tissue that holds structures together abnormally. Now, this fits with what we learned in chapter 3 about the joints. We had the term arthrolysis, which is a surgical loosening of a fused joint. Now we've got tenolysis, the release or loosening of a tendon from adhesions. Okay, so there's a consistent use of that suffix elysis. But remember, also in this chapter, we have the pathology, myolysis, which means a degeneration of muscle tissue. It doesn't mean loosening of muscle tissue. It means degeneration of muscle tissue. So you need to be careful in your mind of the differences. Arthrolysis and tenolysis go together. They're both procedures. They both relate to a loosening. But myolysis is a pathology that means degeneration of muscle tissue. And then a couple of other terms I'd like you to pair off, again, are the procedures to repair these things. If you remember back in chapter 3, we had arthrodesis, ARTHRODESIS, and that meant the surgical fixation of a loosened joint. Well, we also have in this chapter a similar term, tenodesis, TENODESIS. Tenodesis is the surgical suturing, or we could say fixation, of the end of a tendon to a bone. Okay, so in a tenodesis, we've had something tear loose, we're fixating it, we're suturing the tendon to a bone. That's analogous to the arthrodesis, where we're fixating or putting back together a loosened joint. Then we have two other terms for procedures where I think the textbook is really a little shaky in how they explain them, so I'm going to try to go into a little more detail, which will hopefully help them stick in your mind. First of all, we have electromyography. It's a long word. I'm going to parse it for you. Electro, ELECTRO, myo, MYO, and then graphy, Graphy. Electromyography, or say it fast, electromyography, is a procedure for measuring electrical activity in a muscle. It involves inserting a probe into the muscle and then having the patient perform a series of movements with the muscle, flexing it, moving it in various directions. And then the muscle is actually going to put out an electrical output. And that electrical output is measured, which will give the doctor some idea of the muscle strength and its function. Now, the related but different term is electroneuromyography. That's electro, Electro, then a new word part is inserted, neuro, Neuro, and we have myo, myo, and finally graphy, graphy. An electroneuromyography is a similar but different procedure. It's usually conducted along with the electromyography, but this procedure goes a step further. This procedure is going to measure the function of the nerve trunk going into the muscle. It's not just measuring the electrical activity inside the muscle, it's measuring how well electrical impulses are getting to the muscle. So in this case, the nerves going into the muscle are electrically stimulated, and then the output of the muscle, again, is measured to see how those signals are getting into the muscle and how they're affecting the muscle. The purpose of these tests is to try to isolate the causes of loss of function in a muscle. If there's a known weakness or loss of function, this is a way of pinpointing where the problem is. Okay, now we're going to do a quick practice with these terms. What is the term for the loosening or releasing of a tendon from adhesions? That's tenolysis, Tenolysis. What is the term for the surgical suturing of the end of a tendon to a bone? That's tenodesis, Tenodesis. What is the term for the degeneration of muscle tissue? That's myolysis, Myolysis. And what is the term for the surgical loosening of an ankylosed or fused joint? That's arthrolysis, Arthrolysis. And what is the term for a medication that relaxes smooth muscles in the stomach and intestines? That's an antispasmodic, Antispasmodic. And what is the more technical term for antispasmodic, and what is its correct spelling? That's an anticholinergic, Anticholinergic. What is the term for a procedure for measuring the electrical activity inside a muscle? That's an electromyography. electromyography. And what is the term for the procedure for measuring the function of the nerve trunk connected to a muscle? Well, that's the electroneuromyography. electroneuromyography. Well, okay, I hope this helps you sort through the more difficult pathologies and procedures of Chapter 4. Good luck on your test. This ends this episode of the Medical Terminology Podcast.